In collaboration with problematic pandemics, climate change, political unrest, and an unprecedented level of access to knowledge of these polarizing world issues, there is but one more crisis, that of mental health and well-being. We hear these harmful loops. Everyone's depressed, everyone has anxiety, mental illness is everywhere, and this is true. There is a clearly identified mental health crisis, with more than 1 in 5 Canadians having experienced a mental illness. What's worse, it doesn't look like it's getting better anytime soon. When compared to all other age brackets, the prevalence of mental disorders is most significant among young populations, people between 16 and 24 years of age. Moreover, despite this obvious and pronounced struggle, studies have found that only 18 to 34% of young people with the highest levels of depression or anxiety symptoms actually seek help. I wanted to focus in on the populations of young adults like myself who attended post-secondary school. Often, institutions like universities claim to support student mental health, offering free mental health care and counseling services, free well-being workshops, and more. What I noticed was that despite students identifying as having mental health difficulties and institutions implementing actions to account for this, the uptake of institutions' free mental health care often fails, and students do not access the help they need. I was confused by this. What are these barriers to care? How can they be overcome? Would overcoming them solve anything? This study, which I developed and conducted for my honors thesis project at McMaster University, explored why struggling students access, quit, or entirely forego free mental health care. Post-secondary students are the demographic most directly affected by institutions' decisions surrounding mental health care, yet much of the research guiding these decisions fails to consider student perspectives. Understanding these perspectives could reframe the ways post-secondary institutions evaluate the promotion of existing resources, their effectiveness amidst COVID-19, and reimagine frameworks for new mental health support systems. I conducted 12 one-on-one semi-structured interviews exploring themes such as help seeking, attitudes towards mental health care, McMaster resources, and perceptions of students' own mental well-being. All participants had to identify as currently or recently struggling with their mental health and were in their third year or above. This was done to narrow down our conversations to those that had notable experience with their mental health while on campus prior to the pandemic, during online learning, and with the return to campus this year. I then transcribed and qualitatively coded for emerging themes that pertain to my exploratory research ideas. Following thematic analysis, I was able to identify several themes and subthemes. Primarily, struggling students identified a common ideology. Getting better is a process reserved for those who are perceived to be at rock bottom. These are often perceptions they have of their peers, but were also identified as relative to oneself in an I've been worse kind of mindset. Mental health resources, in turn, are reserved and perceived in the same way. As such, I found that struggling with one's mental health is presently framed as both inter- and intra-personally comparative. This comparison issue leads to a student population that lacks the motivation to care for care. Struggling undergraduate students lack this necessary desire to care for one's own immediate mental health for a variety of reasons in collaboration with the comparison issue. From negative perceptions of the specific university resources, beliefs regarding the function and value of mental health care, and wider perceptions of feeling neglected by the university or social networks, lacking the knowledge to access any form of care, and more. While we cannot ignore the onus of the university to provide accessible and desirable resources for mental health to address the needs of all students, this study found that these barriers also exist internally in the perspectives of undergraduate students. This being said, adequate promotion of desirable mental health care became the job of the university the moment it decided to become a place of more than just education. This thesis not only aided in our growing understanding of how students deal with their mental health, but it also explored the impacts of the ongoing pandemic on student attitudes towards mental health care, hybrid and online education, and how these things affect student perceptions of their own well-being. Novel research like this, exploring student misconceptions of mental health care that would benefit from correction, has only aided to the mounting evidence to suggest that knowledge translation and education on accessibility to health services are increasingly needed in post-secondary institutions. Future research would benefit from working directly with campus mental health services to better understand the interactions students have with on-campus mental health care. In my own study, the Student Wellness Center didn't have any kind of transparency report, which would have assisted in exploring the differences in student perceptions and realities of the resources. Working with different campus mental health services to develop a transparency report composed of feedback surveys, a record of reasons for signups and cancellations, and exploring which resources are the most desired would aid in the university's decisions regarding funding, models of care, and promotion of resources. As such, it becomes the job of both students and the institution to correct the false perceptions of who does and does not deserve mental health care, ensuring that not only is it okay to not be okay, but it's also okay to consider yourself comparatively okay and still want help.